Welcome everyone. Today, we're going to talk about a very important eye condition called glaucoma. It's often called the silent thief of sight, and for good reason. Unlike many other health issues, glaucoma typically progresses without noticeable symptoms until significant and permanent vision loss has already happened. The scary part? Once vision is lost due to glaucoma, it cannot be restored. That's why understanding this disease and protecting your vision for life is so incredibly critical. Our goal today is to empower you with essential knowledge to better understand glaucoma and proactively care for your eyes. So, what exactly is glaucoma? It's not just one disease, but actually a group of eye diseases that all share a common outcome: they cause damage to the optic nerve. Think of your optic nerve as the vital cable that sends all the visual information from your eye to your brain. When this cable gets damaged, your brain can't receive those signals, leading to vision loss. This damage is most often, but not always, linked to elevated pressure inside your eye, what we call intraocular pressure, or IOP. Imagine your eye is like a balloon, and if the pressure inside gets too high, it can pinch and damage that delicate optic nerve. The key takeaway here is that if glaucoma is left untreated, it leads to irreversible vision loss and even blindness. This is why it's earned that chilling nickname, the silent thief of sight. It doesn't usually give you warnings, like pain or obvious blurriness, until permanent damage has already occurred. This is why early detection and proactive management are absolutely critical for preserving your vision. Aging is one of the most significant and well-established risk factors for glaucoma, especially for the most common forms. While it's a common misconception that all older adults automatically have high eye pressure, the reality is a bit more nuanced. First, as we age, the eye's natural drainage system, a spongy tissue called the trabecular meshwork, can become less efficient. Think of it like a drain slowly getting clogged over time. When the fluid inside your eye, called aqueous humor, doesn't drain as effectively, it can build up, leading to an increase in that crucial intraocular pressure, or IOP. Second, even if an older person's eye pressure isn't exceptionally high, their optic nerve itself might be more susceptible to damage. Age-related changes can make the nerve more fragile and less able to withstand even normal levels of pressure. This is a key factor in normal tension glaucoma. Finally, with age, the natural lens inside your eye, the part that helps you focus and where a cataract forms, tends to thicken and expand. In some individuals, this thickening can push the iris, the colored part of your eye, forward, narrowing the drainage angle. If this angle becomes completely blocked, it can lead to a sudden and dangerous spike in eye pressure, causing an acute type of glaucoma called angle closure glaucoma, which is a medical emergency. Glaucoma isn't just one condition, it's an umbrella term for several distinct types. The most common form, especially in older adults, is primary open-angle glaucoma, or POG. This is a slow-progressing disease where the eye's drainage system appears open, but the fluid just doesn't exit as efficiently as it should. The dangerous part here is that initial vision loss usually starts in your peripheral, or side, vision, and your brain often compensates, so you might not notice it for years. Then there's angle closure glaucoma. This type is more acute and is a medical emergency. It happens when the eye's drainage angle suddenly gets blocked, causing a rapid and severe spike in eye pressure. Symptoms like intense eye pain, sudden blurred vision, redness, or seeing halos around lights can appear quickly and require immediate medical attention. Normal tension glaucoma is when optic nerve damage occurs even though eye pressure remains within the statistically normal range. As we discussed, an aging or vulnerable optic nerve can be a significant factor here. Secondary glaucoma arises as a result of another underlying medical condition, an eye injury, or even the use of certain medications like corticosteroids. And finally, congenital glaucoma is a rare type that affects infants, typically due to improperly formed drainage canals at birth. While we often associate glaucoma with aging, it's crucial to understand that it can affect individuals of any age, including infants, children, and young adults. Though less common than in older populations, glaucoma in younger people can sometimes be more aggressive. One type is congenital glaucoma, also known as infantile glaucoma. This rare but serious form is present at birth or develops within the first few years of life. It's caused by the eye's drainage system not developing correctly. Unlike adult glaucoma, symptoms are often visually apparent and should prompt immediate medical evaluation. Look for signs like unusually large eyes, extreme sensitivity to light, excessive tearing, or a cloudy appearance to the clear front part of the eye. Early diagnosis and often surgical intervention are critical. Then there's juvenile open-angle glaucoma, or JOAG, which is diagnosed in children, teenagers, or young adults, typically between ages 3 and 40. This form is often hereditary and may be linked to specific genetic mutations. Similar to adult open-angle glaucoma, it often has no noticeable symptoms in its early stages. Lastly, secondary glaucoma can occur at any age as a result of other underlying conditions or events, such as eye injuries, chronic inflammation inside the eye, or prolonged use of corticosteroid medications. Glaucoma and cataracts are two of the most common age-related eye conditions, and it's very common for older adults to develop both. While they are distinct diseases, they can be closely related in their development and management. First, they share a common risk factor, aging. Second, cataracts can directly influence glaucoma. As the eye's natural lens thickens with age, it can push the iris forward, narrowing the eye's drainage angle. If this angle becomes sufficiently narrow or blocked, it can trigger acute angle closure glaucoma. Also, a dense cataract can make it difficult for your eye doctor to clearly view and monitor your optic nerve. Conversely, certain glaucoma treatments can impact cataract development. Some glaucoma eye drops, particularly long-term use of steroid drops, can accelerate cataract formation. And some types of glaucoma surgery can sometimes speed up the progression of existing cataracts. The good news is that when a patient has both conditions, the treatment plan often becomes integrated. Modern techniques often allow for combined procedures, such as performing minimally invasive glaucoma surgeries, MIGS, at the same time as cataract surgery. This can address both conditions in one session. However, it's critical to remember the fundamental difference: vision loss from cataracts is reversible with surgery, because it's just replacing a cloudy lens. Vision loss from glaucoma, however, is irreversible because it involves permanent damage to the optic nerve. This distinction underscores the paramount importance of early detection and ongoing management for glaucoma. The most dangerous aspect of common glaucoma, particularly open-angle glaucoma, is its lack of early symptoms. Vision loss typically begins subtly in your peripheral, or side, vision. Many individuals remain unaware of the problem until substantial, irreversible damage has already taken place. This is precisely why it's earned its "silent thief" moniker. When symptoms do appear, especially in more advanced stages or acute forms like angle closure glaucoma, they can be quite noticeable and alarming. These can include severe eye pain, blurred or hazy vision, seeing rainbow-colored circles or halos around bright lights, redness in the eye, and even nausea and vomiting, often accompanying severe eye pain. A headache can also be a sign. If you experience these acute symptoms, seek immediate medical attention. Given glaucoma's stealthy progression, early detection truly hinges on regular, comprehensive eye exams. These thorough evaluations go far beyond simply checking your vision for glasses. They are crucial for identifying eye diseases in their earliest stages, often before you notice any symptoms. A complete eye exam typically includes several vital tests. Visual acuity test: this measures how clearly you see. The peripheral, or side, vision test, also known as a visual field test, helps your doctor map out any blind spots that might be caused by optic nerve damage. The eye pressure test, or tonometry, is vital for glaucoma screening, measuring the pressure inside your eye. A slit lamp examination provides a highly magnified view of the front structures of your eye. And finally, a dilated eye exam, also called a retinal examination, is paramount. After eye drops widen your pupils, your doctor gets a wide, clear view of the back of your eye, especially your optic nerve, where signs of glaucoma damage are assessed. It's very important to arrange for a ride home after this, as your vision will be blurry and sensitive to light for several hours. For a complete eye exam that includes glaucoma detection, you can confidently see either an optometrist or an ophthalmologist. Both are highly qualified eye care professionals, though their training and scope of practice differ. Optometrists, or ODS, are your primary eye care providers. They complete 4 years of optometry school after their undergraduate degree. They are fully qualified to perform comprehensive eye exams, diagnose a wide range of eye diseases, including glaucoma, and prescribe eyeglasses and contact lenses. For glaucoma, optometrists can detect early signs, diagnose the condition, and initiate treatment, typically by prescribing medicated eye drops. They also manage many glaucoma patients long-term. If they identify a complex case, rapid progression, or a need for surgical intervention, they will refer you to an ophthalmologist. Ophthalmologists, on the other hand, are medical doctors, MDs or DOS. They complete medical school, an internship, and a 3-year residency specializing in eye care and eye surgery. They can do everything an optometrist can, but their medical and surgical training allows them to treat more complex eye conditions and perform eye surgeries. For glaucoma, ophthalmologists can diagnose all types and provide the full spectrum of treatment, including medications, laser procedures, and surgical interventions. Regular, comprehensive eye exams are truly your best defense against glaucoma. The recommended frequency depends on your age and whether you have any risk factors. For individuals with unknown risk factors for glaucoma, if you're under 40, you should get an exam every 5 to 10 years. From ages 40 to 54, every 1 to 3 years. From 55 to 64, every 1 to 2 years. And for ages 65 and older, every 1 to 2 years, or more frequently as advised by your doctor. Now, if you do have risk factors for glaucoma, which include being age 40 or older, having a family history of glaucoma, being of African American, Hispanic/Latino, or East Asian ancestry, having high eye pressure, diabetes, high blood pressure, extreme nearsightedness or farsightedness, a history of eye injury, or certain steroid use, your schedule changes. Under 40, every 2 to 5 years. Ages 40 to 54, every 1 to 3 years. Ages 55 to 64, every 1 to 2 years. And for ages 65 and older, it's every 6 to 12 months. It's also particularly important for parents to be aware of the signs of congenital glaucoma in infants and seek immediate medical attention if symptoms like enlarged or cloudy eyes, excessive tearing, or light sensitivity are observed. Similarly, young people with a family history of glaucoma should begin regular screenings earlier. Let's talk about the proactive steps you can take to lower your risk or slow down glaucoma progression. Since vision loss to glaucoma is irreversible, our focus is always on prevention of further damage. First, and this is without a doubt the most crucial step, prioritize regular comprehensive eye exams. Glaucoma often progresses silently, meaning you won't notice symptoms until significant, irreversible vision loss has already happened. Regular checkups are your best defense, allowing your eye doctor to track changes and intervene promptly. Second, if you've been diagnosed with glaucoma or high eye pressure, adhere strictly to your prescribed medication. Consistent and correct use of your eye drops is the single most effective way to slow down progression. Even missing a few doses can allow eye pressure to rise and potentially cause further damage. Remember, glaucoma treatment is typically lifelong, so always communicate any side effects or difficulties with your doctor. Third, maintain a healthy lifestyle. This includes a balanced diet rich in antioxidants from colorful fruits and vegetables, and healthy fats like omega-3s. Regarding fluids, it's important to sip water steadily throughout the day rather than chugging very large volumes in a short time, as this can cause a temporary spike in eye pressure. Also, be mindful of excessive caffeine intake, as it can temporarily increase intraocular pressure in some individuals. Continuing our discussion on proactive steps, let's look at more ways you can help preserve your vision. Fourth, regular exercise is beneficial. Moderate aerobic exercise, like brisk walking, jogging, or cycling, can help lower intraocular pressure and improve blood flow to your optic nerve. However, it's important to consult your eye doctor about specific exercises. Some activities, such as inverted yoga poses, headstands, or heavy straining during weightlifting, can temporarily increase pressure in your head and eyes, which can be detrimental if you have glaucoma. Fifth, maintain a healthy weight and manage any underlying health conditions. Obesity can be linked to higher eye pressure, and keeping systemic conditions like diabetes, high blood pressure, and high cholesterol well controlled is crucial, as they can negatively impact eye health and exacerbate glaucoma. Sixth, protect your eyes from injury. Eye injuries can directly lead to a type of glaucoma called secondary glaucoma. Always wear appropriate safety glasses or goggles when engaging in activities that pose a risk to your eyes, such as sports, DIY projects, gardening, or working with chemicals. Seventh, manage stress. Some research suggests that chronic stress may contribute to elevated eye pressure. Incorporating stress-reducing activities like meditation, deep breathing exercises, or hobbies into your routine can be beneficial. And finally, avoid smoking and limit alcohol. Tobacco use is linked to higher intraocular pressure and negatively affects blood flow to the optic nerve. Quitting smoking is paramount for your overall health, including your eye health. While moderate alcohol consumption may not be harmful, heavy drinking can also increase your risk of glaucoma. Being mindful of specific medications, dietary choices, and supplement use can also play a role in managing glaucoma risk and progression. It is absolutely crucial to inform every doctor and pharmacist you see that you have glaucoma, or are at risk. They need to know so they can avoid prescribing medications that could be harmful. Always review all your medications, prescription, over-the-counter, and even herbal supplements, with your eye doctor. The most common and significant class of medications that can induce or worsen glaucoma are corticosteroids, or steroids. This risk applies to all forms: eye drops, oral pills, inhalers, nasal sprays, and even injections. Individuals with pre-existing glaucoma or a family history are particularly at risk. Also, be aware of anticholinergic medications like certain antidepressants, older antihistamines, and decongestants, which can affect the eye's drainage system and potentially trigger acute angle closure attacks in susceptible individuals. And some sulfa-containing drugs, like topiramate, used for migraines, can cause a sudden, acute angle closure glaucoma. Regarding diet, while it's more about general health, prioritize foods like leafy green vegetables, colorful fruits and vegetables, and omega-3 fatty acids found in fatty fish or flax seeds. These are beneficial for overall eye health. As for supplements, the evidence for them preventing or treating glaucoma is currently limited and inconclusive. While many are marketed for eye health, they should never replace prescribed medical treatment for glaucoma. Things like ginkgo biloba, omega-3s, and B vitamins are areas of ongoing research for their potential roles, but they are not yet established treatments for glaucoma. The golden rule is to always maintain open communication with your eye doctor. Never start or stop any medication or supplement without their guidance. While current glaucoma treatments effectively manage eye pressure and slow progression for many, research continues to push the boundaries, offering exciting new possibilities for the future. Imagine not having to remember daily eye drops. Newer innovations include sustained-release medication implants, tiny devices placed in or on the eye that slowly release pressure-lowering medication over several months. This can ensure consistent drug delivery and improve convenience for patients. Beyond simply lowering eye pressure, a significant area of research focuses on directly protecting the optic nerve from damage. These are called neuroprotection therapies. These strategies aim to make the optic nerve more resilient to various stresses. Gene therapy is another cutting-edge field exploring the possibility of using genetic material to treat glaucoma at a fundamental level. Researchers are investigating ways to introduce genes that help the eye produce its own pressure-lowering agents, protect or even regenerate optic nerve cells, or correct underlying genetic mutations. Finally, advanced diagnostics and personalized medicine are leading to even earlier and more detailed detection of subtle changes in the optic nerve, which could lead to more personalized treatment plans tailored to your specific type of glaucoma. It's important to remember that many of these innovations are still under investigation or in clinical trials. They are not yet universally available or a replacement for existing, proven treatments. However, they represent a hopeful future for glaucoma management, continually striving for better vision preservation and improved quality of life for patients. A glaucoma diagnosis can be a challenging and emotional experience. It's normal to feel worried, frustrated, or anxious about your vision. Remember that you are not alone, and managing your emotional well-being is an important part of living with the condition. Don't hesitate to discuss your feelings with your eye doctor, family, or friends. Support groups, either in person or online, can also provide a valuable community where you can connect with others facing similar challenges. If glaucoma has already caused some vision loss, specialized low vision services can help. Low vision specialists can teach you strategies and provide adaptive devices like magnifiers or specialized lighting to maximize your remaining vision and maintain your independence and quality of life. Reputable organizations like the Glaucoma Research Foundation, the American Academy of Ophthalmology, and the Prevent Blindness organization offer extensive information, patient education materials, and often directories for support groups. And it's important to hold on to hope through research. Scientists are constantly working to better understand glaucoma, develop new diagnostic tools, and discover more effective treatments, including therapies to prevent optic nerve damage and innovative surgical techniques. In conclusion, glaucoma truly is the silent thief of sight, a complex and often insidious eye disease that can lead to irreversible vision loss. While it is predominantly associated with aging, it's vital to recognize its presence in younger individuals, including infants and children, and its intricate connections with other age-related conditions like cataracts. The cornerstone of battling glaucoma lies in early detection through regular, comprehensive eye exams performed by qualified eye care professionals. These thorough examinations go far beyond simple vision checks, meticulously evaluating the health of your optic nerve and the internal pressure of your eyes. Furthermore, being informed about factors that influence glaucoma progression is incredibly powerful. This includes diligently adhering to prescribed treatments if diagnosed, embracing a healthy lifestyle through diet, exercise, and stress management, and being aware of specific medications that can impact your eye pressure. Remember, vision loss to glaucoma cannot be restored. Your vision is priceless. Please, prioritize your eye health by scheduling those regular comprehensive eye exams. Don't wait for symptoms, by then, it might be too late. Take proactive steps today to protect your vision for life.